More than 9 million Canadians are living with diabetes or prediabetes. The chronic, often debilitating and sometimes fatal disease can often be avoided by maintaining a healthy weight and lifestyle. Catherine Hansen has more on today's To Your Health.
And now, To Your Health, brought to you by 3rd Avenue Pharmacy and Heart Drugs.
Checking her blood sugar and injecting herself with insulin before she eats is a new routine for Amy Blanding. The 31-year-old musician and student found out just 2 months ago she has type 1 diabetes.
I was really thirsty. I dropped about 20 pounds in the course of about a month. I was peeing all the time. I was eating constantly and craving really bad foods, really high caloric foods and sugary foods and things like that. I was really tired.
Blanding is one of the 5 to 10% of diabetics who suffer from type 1, which occurs when no or very little insulin is released into the body. As a result, glucose builds up in the blood instead of being used as energy.
In simple terms, type 1 diabetes is more commonly the condition that is diagnosed earlier, generally speaking, and it is a condition of absolute insulin deficiency in the body, versus type 2 diabetes, which is generally an acquired condition over time, due to initially insulin becoming kind of lazy in the body.
It's the side effects that have the medical community concerned about the growing number of type 2 diabetics, especially because the condition is seen to be preventable by maintaining a healthy weight and lifestyle.
The potential complications of diabetes is heart disease, kidney failure, eye problems or vision loss, and damage to the small blood vessels and nerves in the feet that can lead to infection and sometimes amputation.
Texter says there's a misconception type 1 is a more genetic condition and a family history is a significant risk factor for developing type 2 diabetes.
We are seeing an increase or a rise in the number of type 2 diabetes being diagnosed all the time, probably related to the increase in obesity in our population. And the impacts on the healthcare system are enormous, partly because of the complications I've referred to.
Blanding is well aware of the possible complications of her condition and continues to stay active and is well aware of her diet.
You can't really just eat whatever you want because you have to account for it with insulin, but I think it's a good thing to be aware of what you eat.
Once you have developed diabetes, the condition stays for a lifetime, and that's why Dr. Texter and other healthcare professionals continue to work to keep those at risk to stay healthy. To Your Health, Catherine Hansen, CKPG News.